What does it mean to be a healer? I think back about my medical degree, and I think about, all the things we learn. We learn the pathophysiology, we learn medications, we learn pharmacology, anatomy, physiology, all of that. And then we say, okay, now we know all these things, and then we go right to the clinicals, rotating through medicine, pediatric surgery, OBGYN. We do all those things. Then we come out with this stamp degree that we know we are doctors. And we think we can go out there and say, hey, tell me about your problem. And people come to you and they say, I have a headache, I have abdominal pain. And then you almost have to become an investigator. You have to say, hey, I know this method. I've learned this method from medical school because I have to do this checklist type of thing, right? Where what makes your pain worse? What makes your pain less? Where does it start? All of that. I have to get all of that historical information on that symptom. You get very good at listing out the diagnosis, the differential, and saying, okay, this is all the things it could be. Let's kind of play this game and say, okay, let's X this one out, edit this one out. Maybe it's this, maybe it's that. And then we mull about it and we think, okay, let's give this medicine now. Then you think you've helped the person because you've labeled the diagnosis and you've given the medicine. And that's a great thing. That's not a bad thing. However, if we think about root consciousness medicine, if we think about going to the conscious, you have to ask those questions about who are you? Where are you? What's happening in your world? Where do you struggle? What are your challenges? What is your pain? Not where is your pain, but what is your pain? And if we can just start with that, we get to the same solution. That diagnosis, maybe we get a lot more. Maybe we actually go in and say, hey, you know what? If we can work at that root of the source of your pain, we can actually go deeper and we can actually say, hey, we can support that. We can guide you through that. You can guide yourself through that. You have the power now to understand where your struggle is. Let's go from there. And when we talk about meeting people and anybody's story, and you think about narrative medicine, I often get that question, like, what is narrative medicine? Having the empathy to spend time, having the ability to use creative ways to getting to the story of illness and understanding that story in context, because that illness is not without context. That asthma is not without context. That person who has a heart attack is not just having a heart attack out of context. There's some more, and there's lots more happening in that person's world than just that little label. If we can integrate that with conventional medicine as well as non-traditional, plant-based, psychedelic therapies such as ketamine, which is legal, we can go deeper into people's mental health and well-being.